So you're going to put lavender. You're going to put a couple of drops on the palm of your hand. And then you're going to rub your hands together like this and inhale for a minute. Just breathe them in. Lavender is an anti-inflammatory. And it can penetrate the skin rapidly. Keep inhaling. Keep inhaling until there's no more smell. And this relaxes you and it gets us in the mood. I'm going to start a brief presentation here with slides. And as you've heard, essential oils are very versatile, and we're going to talk about how to use them for helping with some illnesses and some discomforts that we might be having. The first medical textbook was 65 years after AD, after the birth of Christ. It's called the Materia Medica. And in that book, there are more than 200 essential oils mentioned to promote health and wellness. This was the precursor to the pharmaceutical textbooks we have today. This was written almost 2,000 years ago. And they knew that essential oils were very important for the preservation and management of different things. The chemical properties of the oils that we're going to speak about in brief are due to their contents. There are phenols, monoterpenes, sesquiterpenes, aromatic rings, which are very similar to the aromatic rings of gasoline, alcohols, aldehydes, and ketones. So this gives the essential oils their property. And essential oils are basically the part of the plant, flowers, stems, roots, leaves, that contain oils that have a certain property. The terpenoid alcohols, for example, are anxiolytics. So by smelling them, they go into the olfactory nerve and will act on the thalamus and the brain cortex to relax, sometimes in a matter of minutes. Some of them are citrus oils like orange, citronella, geranium, and they have been shown in studies to decrease anxiety and depression. So when we inhale the essential oils, we're bypassing the blood-brain barrier. The oils go to the cerebral cortex, thalamus, and limbic system, and it can alleviate symptoms of anxiety, depression, and insomnia. So this is very important because the limbic system is the primitive brain, and by just inhaling this lavender and other oils, we can increase the production of dopamine and serotonin, which are the hormones that give a sense of well-being to human beings. And the essential oils are produced by plants to protect against stresses, temperature variations, droughts, cold, plagues, and they protect against free radicals as well and fight infections like bacterial, viral, fungal, and parasitic. This is the aromatic benzoin ring that promotes diffusion into the air rapidly by essential oils. And in this slide, we see the cerebral areas, occipital lobe, cerebrum, temporal lobe, frontal lobe, hippocampus, amygdala, And these are areas where the oils act upon. And how can they act upon these areas so rapidly and with such a beneficial effect? Because they're not only naturally occurring, which is something that the body likes, but they're volatile because of that benzene ring. Volatile means that it will spread into the air rapidly. So they can act on the atmosphere that we are in, and they will promote the enhancement of ozone production, decrease in bacteria, viruses, fungus in the air, and also surfaces. In addition to that, the oils are absorbed rapidly into the body. They can penetrate centimeters in a matter of minutes, as opposed to other oils that are not aromatic, like coconut oil, almond oil, sesame seed oil are non-volatile. So they stay oily on your skin. They don't absorb. Essential oils are absorbed through the skin. So as we're doing this tonight, you will notice your hands in a matter of minutes, they'll get dry. That means they're being absorbed through the palms of your hand. So it's good to keep this in mind because these properties are what allows the oils to do the effects that we're going to talk about tonight. So they can diffuse inter and intracellularly once inside the body, and they're extremely lipid soluble with weak water solubility. So that allows them, you're inhaling them, you already have particles of the oils in the olfactory nerve that is right behind, in between the eyes. You put your finger and point towards the brain, that's the olfactory nerve. And the brain is extremely lipid soluble, so the oils are going into the brain area. As I mentioned, they're antibacterial, antifungal, antiviral, and antiparasitic, and they are able to dissolve plastics and petrochemicals. So when they go to your body, they also have been shown to dissolve these things in the body. They also can be analgesic, which means that they will decrease or clear pain in your body. So as you can see, they're penetrating, anti-inflammatory, like lavender oil that we just smell, and analgesic, they can be used for pain, and they may help patients with pain. They're extracted through steam distillation or absolute ethanol extraction. The modes of application are inhalation, or aerial diffusion through the air, direct application on the skin, or ingestion. Like I mentioned, through its effect on the limbic system by direct inhalation through the olfactory system and nerves, you can promote dopamine and serotonin secretion, so you're going to feel good. And another important thing about the limbic system is that that's where we house emotions and memories and subconscious thoughts. So this may be able to improve your emotions, enhance your memory when you're inhaling them, not only because you're relaxing, and when we're relaxed, we can memorize and process information easier, but also because dopamine and serotonin enhance memory and subconscious thoughts of stress, depression, insomnia, for example, may be helped through the simple inhalation of these oils. The thalamus is a part of the brain that processes all the sensory situations, from sight, hearing, cold, hot, pain, but the only sense that doesn't get processed in the thalamus, that processes the information that then the brain cortex decides what to do with it, is the only sense where the information goes directly from the area of the olfactory nerve into the cortex, into the brain. That's how important the body has decided that the smell is. And it makes perfect sense, because we have to know right away if something is pleasant or unpleasant for us to decide whether to, for example, eat it. That's why we have the nose right on top of the entrance of the mouth. Or if we're moving into a pleasant or unpleasant environment that smells good or not that good. So we have that capacity to decide right away without the processing of the thalamus whether we should be getting involved with that situation or not, depending on the smell. They also have antiviral activity. Tarek, in 2019, published a paper showing that essential oils are effective in eliminating RNA and DNA viruses, herpes 1 and 2, dengue, influenza, polio, June, Coxsackie virus. So this is very important for the uses we can give them. I recently sent a viral victory synergy that I developed into a laboratory in the United States 2 years ago after the coronavirus outbreak. And the laboratory took cells that were infected with coronavirus and they sprayed them with this viral victory that was a 10% dilution. So 90% water, 10% of the oil. And they found that in less than 10 minutes, 100% of the coronavirus was killed and 0% of the cells that were infected. Well, I can give you other things that are toxic, that are common household item and sprays to kill the coronavirus, but they also will harm our normal cells. So we want things like this that will kill the virus but not harm your cells. So we have to be very careful with Clorox, Lysol, things that we know can kill coronavirus and other viruses, but also will affect your cells. And the viral victory contains thyme, clove, oregano, essential oil of orange, and essential oil of lavender. So these 5 essential oils, thyme, clove, oregano, orange, and lavender, were sprayed on these cells. And we had the results that I just mentioned to you. There are other antiviral oils like lavender, basil, rose, marjoram, cajeput, cypress, tea tree, eucalyptus, pine, and myrrh. So this is not limited to the ones that I use to make the viral victory, but there's a lot of versatility among oils where you can use many oils to get the desired effect, not just the ones that I have in the blends.
Right.
So this is an example of MRSA, which is methicillin-resistant Staphylococcus aureus, one of the toughest infections there is. They usually can be managed with either high-dose antibiotics in a hospitalization that may require weeks, or more commonly surgery by removal of the infection. But it has been shown in randomized studies that essential oils, in this case, tea tree, but I don't use tea tree personally because I found other oils to be more powerful, but tea tree has been found to be effective on eradicating MRSA, more effective than chlorhexidine or silver sulfadiazine on the skin by application. And it makes perfect sense because of the properties that we just spoke about penetration into the skin in a matter of minutes, and also its antibacterial effect. Also, MRSA has been shown in randomized studies to get bone infections taken care of by MRSA because it will penetrate the skin and it will reach bone. I mean, the penetration of oils is one of the most important properties that I've been using for many years. For example, the lavender oil that I gave you, I use it for bed sores, decubitus ulcers, which are a very big problem in people that are bedridden. So the direct application of lavender oil on bed sores may be able to close it rapidly. And I've seen that in many people that I have seen with bed sores. In addition, let's go back to the inhalation part of essential oils. There are many studies that have shown that essential oils inhaled can reduce the symptoms of stress, depression, and anxiety. I also see that happening in insomnia. That is a very common problem. So I have 4 blends that I have developed over the years. One is the emotion synergy blend. Another one is no stress. Another one, meditation, and another one is balance. And I do them, the four of them in order. The first blend has marjoram and valerian root. The second one contains orange, ylang ylang, and patchouli. The third one, meditation, has juniper berry, vetiver, and lavender. And the fourth one, balance, has geranium rose, lavender, ylang. And when I give patients these oils to inhale, I routinely ask them when they come to my clinic for the first time, how's your stress level now from 0 to 10? 0 being the most relaxed you've been all your life, and 10, panic attack. Most of them are between 5 and 8. When I give them these oils in order at the office, within 5 minutes, 95% of the patients relate to me that from a 5 to 7 score, they went to a 2 to 4 within 5 minutes of inhaling these 4 blends. So you can see the potential that these oils have, and we'll discuss many of them. We'll actually do them. How do you feel after doing the lavender for a couple of minutes?
Very nice.
Relaxed.
So we're going to
Yes.
continue with the other 10 oils, so you can have a wonderful evening, the rest of the evening.
Victor, what was the fourth one? You said one was emotion, no stress, balance, and what was the fourth one?
The third one is meditation, and the fourth one is balance.
Oh,
So the
meditation.
third one,
Okay.
meditation, which contains juniper berry and vetiver, and the balance
Right.
contains geranium rose and ylang, lavender. So those are the ones that I mentioned. And by the way, you can always go to vmvoils.com, which are my initials, Victor
Okay.
Marcial-Vega, vmvoils.com, and you'll see the oils, the ingredients, how to use them, if you have any questions. For cough and cold symptoms,
Okay.
there are randomized studies that
Good.
have shown that mixtures with menthol, camphor, and eucalyptus in the treatment group, these are randomized studies, alleviated cough and cold symptoms much better than just the control, which was just petrolatum. So essential oils can be used
I have
also-
another question.
Yes,
Yes, in dentistry, years ago, maybe 70 years ago, it was considered a very typical protocol when a person had an infected socket. After an extraction, the socket would get infected. They would take oil of cloves, put it on a cotton pellet, and stick it into the bone, into the socket. And of course, the bone would absorb the oil of cloves. So I thought it was interesting because then years later they discovered that the oil of cloves was actually very caustic and actually burned the bone. Do you, and I heard you say that it reaches the bone and it's good. How much oil can reach a bone, and at what point does it become bad for the bone?
I recommend when people have teeth problems like an open socket after an extraction to use lavender oil first.
Right.
And lavender oil will usually help
socket.
with the healing rapidly. But some people that have infections of the of the tooth and hasn't had a procedure yet, I will gladly recommend clove oil. And just for a few days or a couple of weeks, it's not going to harm the bone. I haven't seen damage to the teeth or to the enamel. So I've seen benefits in terms of people that have infections that have not responded to anything conservatively, except for the clove oil. But I recommend first the lavender because it's not as strong as the clove. But I have also used the clove with good results in patients.
Interesting.
So right now, I want you to get your bottle of eucalyptus, please.
Got it.
And before you inhale it, I want to tell you a little bit about eucalyptus. It has two chemicals, aromathendrin and phelandrine. And these promote ozone production in the air. So I use eucalyptus to mop at home. And this ozone will not allow bacteria to survive as easily. And I also spray it in the air conditioner filters so you can spread through the air. And they suck up moisture. These oils of eucalyptus will suck up moisture. So I use it in fever blisters with other oils and place directly in an open sore or a sore that is being felt but not open yet, can be very effective in stopping a herpes outbreak. If you do it at the first minute of the tingly sensation with other oils, so eucalyptus, lavender, tea tree, myrrh, they can be used together or alone. And the eucalyptus is very good to apply, and it can prevent, in many cases, the progression of that sensation. If the blister is already open, it will promote its healing. So usually in 24 hours, it's dry in most patients. So it might help in this situation. And also, it's a antiviral, antifungal. So now I want you to put the eucalyptus in your hands. And they're also it's also a bronchodilator, so it will help you breathe better. Take a deep breath. And you also feel it opening your nose. Blanche, did you put it in your palm already?
No, not yet.
So put a few drops in your palm and inhale. Take a deep breath and keep breathing until you can't smell it anymore.
Ooh, that's strong. Wow.
I've got a question.
Yeah, May.
For the eucalyptus, will that work for kids' athlete's foot? Because they wear covered shoes and play soccer. Do you recommend that will be used for athlete's foot?
It may help, yes. But in athlete's foot, you always have to go to the cause. And sometimes diet has a lot to do with that, because the diet of the person may be promoting fungus around the body. So it's not just managing the foot, but also the whole person and the intestine and other things. But it may help momentarily to help with the athlete's foot, but you always have to go to the cause in these situations, because they usually have other fungus in other parts of the body.
Very true. Okay.
Okay.
Very nice.
So now, and that's why I want to mention to you now the ylang ylang. So if you suffer from low blood pressure, I will keep the rosemary close by. Rosemary and ylang are antagonists of each other. Ylang will relax you and may lower your blood pressure if you have it too high. Usually, if you have it normal, it won't be a problem. But in some people, it can lower the pressure. So if you feel after inhaling the ylang that you're a little getting sleepy and low in energy, get the rosemary and inhale it, because rosemary would increase your alertness and may increase the blood pressure a little bit to counteract the ylang. Rosemary, I'm not going to recommend. You're going to do it in the morning, because I don't want you to stay awake tonight.
Right.
So the rosemary will be the last
Thank you.
that you'll do in the morning. So let's get the ylang. The ylang bottle. Put a drop on your palm and inhale. Did you find the ylang?
Yes.
Yeah, I found it.
So put a couple drops in your palm and let's
This
inhale.
better not put me to sleep. I still have a lot of work to do.
It will get you prepared for work. It will, I'm not gonna put you to sleep now.
Ooh, this is different. Very unusual scent.
So in people that have high blood pressure, you will give them this to inhale. And you may see the pressure going down within minutes. So it's a very useful oil for that particular purpose. Ylang is also an aphrodisiac. Are we ready for the next oil?
Yes.
I see that May is not in the conference anymore.
I'm here.
Yeah, I know. Yes. So clary sage is the next one. It's also a very relaxing oil, but it has a unique property. It's an analgesic. So for pain, it can be very useful together with lavender. That is the first one we did. So clary sage applied to areas of pain is also anti-inflammatory and very good to deal with the pain. But not only did they have a property of anti-inflammation, but also they're antibacterial. Very commonly, areas of pain are inflamed, and bacteria and other microorganisms may take advantage of this and start infecting the area. So this is also a muscle relaxer. So you're going to put a couple of drops also on your hand, and you're going to inhale. How do you feel with that oil, May?
Awesome.
Excellent. So now we're going to the next one, which is cypress. By the way, cypress is a bronchodilator and also is a anti-cough, anti-tussive. So people that are coughing very commonly may get a decrease or a disappearance of the cough by inhaling cypress. Do you have your bottle ready?
Yes.
So put a couple of drops on your palm. Cypress oil and inhale.
So this is pure cypress. It's not blended with anything.
These are all single oils, including this cypress that you just did.
Mm. Nice.
Now the next oil is cajeput. Cajeput smells similar to eucalyptus. It is also an anti-cough and a bronchodilator. Did you find it?
Yes.
So put a couple of drops on your palm. Rub your hands together and inhale.
Mm.
It's also a decongestant. So it will help your nose open up, decongested.
Cajeput. It's quite soothing.
So now we're going to move to orange. So look for your bottle of orange. Orange essential oil is very relaxing and also is good to mix with other oils. It will enhance other oils that are relaxing, like clary sage, ylang, lavender. And you can start mixing and blending different oils. So this one is a good one to mix. It also contains vitamin C. It comes from the peel of the orange. So this enhancer of other oils, we're going to put on the palm of the hand and inhale. And immediately you notice the orange flavor.
Mm. Yes. Totally reminds me of my grandmother.
Wonderful. Now we're going to bring you up a little bit because we've done enough relaxing oils for a while. And the one we're going to use next is called marjoram. And marjoram, I used them in the beginning for panic attacks. People that will come to my office crying because of a stressful event or in a panic attack. And
Right.
this is part of the emotion blend. And it's very good to take care of these situations. It may help people with these panic attacks, but it's also stimulating.
Mm.
Did you find the bottle of marjoram?
Just 1 second, please. Yes, I do.
So put 2 drops on the palm of your hand. It's a very different smell, very pleasing, and inhale.
Yes, it is very different.
It's also analgesic. So I use it in my painless blend together with clary sage and lavender and others to help people that have pain.
Mm.
And it will also soothe them. Sometimes they smell the painless blend and the pain may get better or go away just by smelling it. But I
Mm.
recommend applying it on the skin on the areas that hurt.
Okay.
Lower back, neck, very common, knee. And marjoram is part of those oils. So you have some of those oils here. You have clary sage, you have lavender, you have marjoram, and peppermint. The 4 of them are very good for pain. And right now, the marjoram specifically for panic attacks and people that are crying or very upset emotionally.
Mm.
And we're going to get more alert. So I'm looking now for the peppermint. Peppermint is going to be a decongestant for many people. It's also very good for pain. In some people that have stomach upset or nausea, it can be applied on the abdomen and alleviate nausea or stomach upset. I have used it with people that have food poisoning and apply lavender and peppermint to their abdomen. And all the patients that I have seen have gotten better in a matter of minutes. I'm talking about 10 to 30 minutes, which is quite remarkable for food poisoning. Some people may recommend also to take 1 drop of lavender and 1 drop of peppermint in a glass of water and drink it when there's food poisoning. And that can be very effective. It may help those patients quite rapidly. So did you find the peppermint bottle?
Yes. Without being said, are these ingestible?
Pardon me?
The oils, are these ingestible?
They can be.
Hi.
I have other courses to explain how to consider them for ingestion
Okay.
and how to use them.
Okay.
But tonight is mainly an introduction to the oils. Inhale,
basic.
play it on the skin,
Right.
and for ingestion, I reserve it for other courses.
Okay.
So put 2 drops on your skin. And this is slowly bringing us up now from all the relaxation we had initially. So more alert.
Mhm.
And you can notice the peppermint right away as you inhale it.
Right. It's my favorite.
Yes. It decongests, is also bronchodilator,
Mhm.
and it feels cool on the nose.
Right. Also alertness, because when I was at mass yesterday, it felt like there were too many people. I felt like, am I breathing? And I just put a drop on my palm, I held it, and it worked right away.
So continue inhaling for a little while. Peppermint goes a long way.
Certainly.
So it puts you more alert, as you noticed, but
Mhm.
still relaxed.
True.
And the last oil we're going to do tonight is the hemlock spruce. Let me know when you find the bottle.
Okay. Got it.
So put 2 drops on your palm and take a deep breath and tell me what does it remind you of?
Okay. I want to say more like chamomile combined with lavender. I don't know.
Does it remind you of the Christmas tree?
Yeah.
That's exactly the oil that we obtain from the pine needles of the Christmas tree, which is hemlock spruce. That's the official name.
Mm. Love it.
And that's also a decongestant, relaxer, antifungal, antiviral, and antibacterial. So these
Very
oils are not just to inhale, they put us in a mental and an emotional trip while we're smelling.
Mm-hmm.
So you can see how they can affect behavior, how we feel, being alert and focused. And tomorrow morning, I would like for you to do rosemary after you wake up. Because the rosemary sometimes can substitute the need for things like coffee. Some people need coffee to stay awake in the morning. But I want you to do the rosemary when you're ready to wake up
Mm-hmm.
and inhale it and tell me if you notice the difference.
Okay.
Or
But I
you
don't
can send me a
coffee.
text or call me. I'm sorry?
I don't drink coffee.
So I want you
Oh,
to do it anyways when you wake up so you can see the difference of these
okay.
relaxing oils versus a rosemary that can bring you up and give you energy. I use rosemary in an energy blend that I have that contains peppermint, rosemary, hemlock spruce, and other oils that will bring you up. They will not put you hyper, but they will bring you to an alert state.
I was just going to ask you that because I'm very energized naturally. So
Excellent. I would like
yeah,
for
I
you
will
to pay
try.
attention to the dreams you have tonight after smelling these
Okay.
oils. How do you feel now besides energized?
Calm.
Yes.
I feel really calm. I feel like I can maybe walk a block.
That's wonderful. And that's what the oils can do for you and your loved ones and people that you work with. So I encourage you to keep exploring. The next course I'm going to give will involve how to blend essential oils. And I will
Okay.
keep you posted of all this. Do you have any more questions?
Okay, so you did say to try the rosemary first thing tomorrow morning, and then
Correct.
also pay attention to my dreams.
Yes. And then I would appreciate it if you report back to me so I can get some feedback and how you
Okay.
slept, how you did during the night.
Okay, I certainly can do that. And you said that next time you could tell me which ones can be ingested, like some of the oils.
The ingestion is for another course, and that course is usually
Okay.
for medical doctors, dentists, and medical students. Because
Okay.
now we're getting into the
And
medicinal,
students. Okay.
Yes, we're getting into the medicinal side of it. And each
Mhm.
one has to be responsible to how they use it in ingestion, because that's a whole different ballgame.
Okay.
So keep
Lovely.
you posted about the course.
Mhm.
Well, take care and thank you very much for your attention. And take
Oh,
good
thank
care.
you. You have a jolly evening.
You too.
Bye for now.
Bye.
Cheers.